Afternoon. The Minnesota Senate Commerce and Consumer Protection Committee will come to order. Welcome, everybody. Today is Tuesday, January 31, 2023. It's 12:33 p.m. and we have a quorum. Today in front of us we have Senate File 2, and thank you to the author for coming to present the bill today. And before we go to the presentation of the bill, I'm just going to run through a few things. This bill has already had a few committee stops, and we'll have at least 5 more that we know of before this is over. The specific jurisdiction of this committee for members and for testifiers and for the author is section 15 of the bill, and also a small part of section 10, subdivision 6. If possible, I would ask testifiers and people at the table to confine their remarks and comments to the areas of expertise and jurisdiction of this committee. We do have a very large number of testifiers today, and we also have a number of amendments that the author has worked on with the minority party to try to improve this bill, as befits a significant piece of legislation such as this. So I'm just going to run through the run of show so that we can honor all the people who have come to present on this today. We are going to first have Senator Mann present the bill and go to her testifier, and then have Commissioner Grove speak. And thereafter, we're going to take a break and do the amendments that have been offered by the committee. We'll go through those and vote on those, and then we will return to the remainder of the testifiers. I'm going to ask testifiers to confine your remarks to 2 minutes and to try not to repeat the remarks of people who have gone before you if possible. We won't have you on a strict clock or anything like that, and won't give you a flag to make you stop talking. But if you see me sort of turn my microphone on and lean in, it's time to start wrapping things up and move on. And with that, I think we are ready. We have a quorum, and Senator Mann, to your bill.
Thank you, Mr. Chair, members. Senate File 2 establishes the Minnesota Paid Family and Medical Leave Program. It would provide Minnesotans a 12-week leave at partial wage replacement to take care of a new baby, bond with a new child, or take care of themselves or a family member who has suffered a major medical event. Out of almost 200 countries, the United States is one of 7 that does not offer such a program. And the remaining countries are largely micro-islands. In response to that, 11 states and the District of Columbia have already implemented programs like this, and so we have the privilege of learning from them as well as from the rest of the world on what works and what doesn't. We know that when it comes to staying home with a new child, the benefits are innumerable. We have seen decreased maternal morbidity and mortality at a time when the rates of maternal morbidity and mortality in the United States are unacceptably high and continue to grow while the rest of the world's rates decrease. We have seen increased rates and duration of breastfeeding, which we know leads to healthier moms and healthier babies. We have seen increased parental mental well-being, with depression being one of the most costly medical diagnoses we have today. We have seen better health outcomes for children, decreased rates of ear infection, GI infections, pneumonia, overall hospitalizations, and clinic visits. And we have seen increased financial stability after a life-changing event, which leads to more people returning to the workforce instead of leaving it altogether. And that also leads to a decrease in reliance on government services. We know that paid family and medical leave is a gender justice issue. When leave is offered to everyone, the discrimination against women decreases in the workplace. We know that it is a workforce shortage issue. Again, people who have paid leave return to work instead of leaving the workforce. This will affect our child care crisis and our long-term care crisis. And we know that paid family leave is a racial justice issue because too often our BIPOC communities are left out of such benefit programs. Our bill is written in such a way that no one gets left behind. We know that the economic inequality and generational transmission of low socioeconomic status in the United States are perpetuated through disparities in early childhood circumstances. Paid family and medical leave can help curb that growth and inequality and boost long-term economic growth for the entire state. So obviously, paid family and medical leave is an economic issue. With that, Mr. Chair, I would like to introduce to you Ms. Deborah Fitzpatrick, who will give an overview of how the proposed program will work.
Thank you, Senator Mann. Ms. Fitzpatrick, please introduce yourself for the record and proceed with your testimony.
Thank you, Chair Klein. Can everyone see the PowerPoint? All right, excellent. Thank you, Chair Klein, members of the committee. My name is Deborah Fitzpatrick, and I'm the Director of Policy and Research at Children's Defense Fund, Minnesota. In my prior role at the University of Minnesota, I led a nationally recognized research team that conducted Minnesota's legislatively mandated design and implementation study under contract with DEED. I'll spend just a few minutes grounding the committee in the program structure at a high level and be available later for specific questions as helpful. So Senate File 2 sets up a statewide, publicly administered insurance program that is self-funded and sustainable over the long term through contributions from workers and employers. It allows self-employed people and business owners to join the program and employers to provide a comparable program. Eligibility is based on workforce participation and healthcare providers certify need for most types of leave. Much of the program is designed to build on Minnesota's successful UI processes as well as the infrastructure developed in multiple U.S. states. Among design options, this one was chosen for a variety of reasons. I'll lift up three. First, it is a portable wage replacement benefit, which is especially important for workers with multiple employers or those changing jobs. Second, it creates the broadest possible risk pool, a feature necessary for keeping costs low and leveling the playing field among employers. And finally, it is the proven, effective, sustainable salute model that gives all workers an opportunity to earn and count on the benefit from year to year, and it makes the costs currently borne by both employers and workers more predictable. While the bill provides up to 12 weeks for medical and 12 weeks for family leave, experience from multiple states as well as decades of U.S. Department of Labor surveys of employers and employees shows that workers take what they need, and that is on average less than the maximum allowed, even when fully paid and employment protected. For example, Massachusetts allows up to 26 weeks and median leave lengths have been 12. In Washington, the entitlement is 12 to 18 weeks and the average has been around 7. There is no evidence that Minnesota workers are less committed to their employers or coworkers or more inclined to abuse their benefits than those in other states. In fact, one could argue the opposite. Finally, Senate File 2 represents a proven approach that is firmly within the range of what has already been adopted in other states. There is not a single major policy element that isn't the same or exceeded by other states. For example, you can see here that where Senate File 2 falls among states on combined leave entitlements. 5 states exceed the bill in front of you. This bill reflects the policy choices that are factored into the program's cost, with Senate File's initial premium of 0.7, that is also within the range of existing program costs and far from the most expensive, reflecting these deliberate policy choices to create a balanced program. With that, I'll end and be back if there are questions.
Thank you so much, Ms. Fitzpatrick. And if Commissioner Steve Grove is with us today, could you please come to the table? Good afternoon, Commissioner. Pleasure to have you here. Could you please introduce yourself for the record and proceed?
Mr. Chair, members of the committee, my name is Steve Grove, and I'm the Commissioner of the Department of Employment and Economic Development. And thank you for having me here today. I'm excited to talk about this bill. It's an important one, and I come to you not just as a commissioner, but as a father of 2 6-year-olds who 6 years ago had to take paid family medical leave myself, so my wife and I could play 2-on-2 with our little ones and get them through those first 3 months of life. A really valuable benefit that I had because the company that I worked for offered it, and it was really essential to our kids' start in life. Honored to be sitting next to Senator Mann, the bill author here, and I'm here just to share a little bit about how we look at this as a department. We think this is one of the best policies that we could pursue to help Minnesota families and Minnesota workers and it's long since past due for our state to land this policy for Minnesotans. As Deb mentioned a moment ago, 8 states have this in play. 4 additional programs are moving. We are talking to all those states regularly. We're learning a lot about how those programs work, what has been successful, what has been challenging. It has been a great opportunity to be an early state to do this, but not the first. We can learn from some of our neighbors in this front. The policy, as has been stated so far, is just really, really good for women and families first and foremost. Senator Mann mentioned a moment ago some of the early benefits of those first 1,000 days of a child's life, how critical they are to brain development and growth. But I also point out from a workforce standpoint, women who have paid family medical leave when they have a child are 20% more likely to be working 10 years later than those who didn't. It fundamentally changes the trajectory of a person's career when they can take that time, paid time off to take care of their child and get back into the workforce in a much more stable manner. So this is a major issue for women in our workforce in a state where we have a very tight labor market. This is also a huge equity issue in our state on a bunch of different fronts. We all know that the biggest and bluest chip companies in our state offer this benefit almost as a ticket to get in. You can't even not have this policy if you're a big company in Minnesota. But it's the smaller businesses and often the businesses in greater Minnesota. Businesses like my father's landscaping business in Northfield, Minnesota, that could have never offered this policy given the economic climate and dynamics of offering such a program. And additionally, it is workers in communities of color that are far less likely to have paid family medical leave benefits when they come into work each day. So this is an equity issue on a lot of different fronts that we think can make this a much more level playing field for people in our economy. Lastly, I'd just say, as your Commissioner of Economic Development, I care about this not just from the moral fiber of what it means to be in Minnesota, but from a workforce development and economic development perspective. This is a chance to differentiate our state, to put ourselves on the map as a place that has a unique climate to work in, that is thinking about ways to be pro-worker in a way that will attract people to want to come and live and work here. And we believe we can land a policy that works for workers, businesses, and the community. And in looking at other states where business leaders have been surveyed and asked, how is this going in your businesses now that it's up and running, we see great results. I'll give you an example. In California, a survey of businesses found sky-high reviews of the policy within the companies that they were able to add this policy after it came to be. Over 95% approval ratings on a whole host of vectors, whether it's turnover, morale, profitability, and what have you. So this just makes sense for a state that faces some pretty historic challenges with the tightest labor market in our country, and it makes sense to redefine the package of what it means to invest in our people here in the state. So with that, I'll turn it back to you, and thanks for having me.
Well, thank you, Ms. Commissioner, and grateful for your testimony. We are going to transition to amendments, but I wonder if members have questions either for the Commissioner or for Ms. Fitzpatrick. Senator Frentz.
Thank you very much, Mr. Chair. Actually, my question was for the Commissioner. Is that possible? Thank you, Commissioner. Good to see you again. You mentioned the survey where there was 95% satisfaction. That's got our attention. Do you mind saying a little bit more in particular who exactly was surveyed and, random sampling, voluntary participation, what kind of survey? That seems important for the business community watching this develop, that another state might have had that much success. Thank you.
Commissioner Grove.
Mr. Chair, Senator, it's a great question, and I can certainly pass a survey along to you. I can give you a little bit more detail here about it. I think it was a survey of employers broadly in California a couple years after the program had been in place, and it found that 89% said that it had a positive impact on productivity, 91% said it had a positive impact on profitability, 96% said it had a positive impact on turnover, and 99% has said it had a positive impact on morale. So those are the details of kind of the review that those companies gave, and I'd be happy to share with the chair and yourself, Senator, the specific study.
Senator Frentz.
Thank you very much, Commissioner. Thanks, Mr. Chair. You should send that to the members of the committee. I think that's potentially really helpful. Thank you.
Yeah.
Thanks, Mr. Chair.
Okay, members, thank you very much. Thank you, Commissioner. We will move now to member amendments at this point. Senator Rasmussen.
Thank you, Mr. Chair. I would move the A26 amendment.
Senator Rasmussen moves the A26. Please describe your amendment while the clerks disperse the amendment.
Thank you, Mr. Chair. Proponents of the bill have estimated that the payroll tax for the bill will be about 0.7%. However, there's no cap on what that payroll premium could be if costs are higher than expected. And so this amendment, the A26, would cap that premium at 1.2%. The thinking here is that if the costs exceed that deed, it would have to come back to the legislature, and we'd have to figure out what's going on because we were not able to stay under the cap. I think this is a good common sense amendment. It provides certainty for employers. It matches what some other states do, like Washington, and it doesn't allow for a runaway rate without input through the legislative process.
Senator Mann.
Thank you, Mr. Chair. Senator Rasmussen. So we do want to make sure that we are doing all we can to help employers budget and to make sure that employees know what they are to expect in their paychecks. We also want to make sure that we can go back to the drawing board if something is not going well and the rates are going up so high. So at this time, I will accept this amendment.
Further member comments or discussion? Senator Rasmussen. The 826 is before us. All those in favor say aye. Aye. Opposed say nay. 826 carries. Senator Rasmussen.
Thank you, Mr. Chair. I appreciate that and appreciate the bill author and the conversation on the cap. I would move the A37 amendment.
Senator Rasmussen moves the A37 amendment. Please describe your amendment while it is distributed.
Thank you, Mr. Chair. The current bill allows employers to satisfy the paid family medical leave obligations through private insurance. However, in Minnesota law, there isn't anything explicit that authorizes the Commerce Department to approve paid family leave insurance products. So this amendment would make clear that Commerce can approve these private insurance plans.
Senator Mann.
Thank you, Mr. Chair. Senator Rasmussen. So at this time, I would request a no vote on this amendment. I think that the intent is very good, and you have my word that I plan on having more conversations about this. I just want to make sure that I am in line with the Department of Commerce, who I have not had a chance to have a conversation with yet about this. So today, I request a no vote.
Mr. Chair.
Senator Rasmussen.
Mr. Chair, I was wondering if we have, Mr. Kelly or someone here from Commerce who could talk about this.
Mr. Kelly. Welcome to the committee, Mr. Kelly. Please introduce yourself for the record and proceed.
Thank you, Mr. Chair and members, Senator Klein, members. Can I see the amendment? Just wanted- I'm John Kelly. I'm the Director of Government Affairs for the Commerce Department. I'm just reading here. Thank you, Mr. Chair and members. I think that we are generally supportive of the concept here of what Senator Rasmussen is trying to accomplish. I think that we've had some discussions with the author of the amendment. I think we'd like to keep those conversations going and fix this down the line. But we generally are supportive of that clarification.
Senator Rasmussen.
Thank you, Mr. Chair, and I would just ask for this committee. This bill is a really important piece of commerce policy. We're effectively creating a mandate for a publicly provided insurance product while also allowing companies to have a private plan. And so, Mr. Chair, I understand it's your prerogative and others, but would ask that this bill perhaps come back to this committee if we're unable to, especially work with the insurance provisions of the bill, today. But
Thank you, Senator Rasmussen. We'll consider that. Do you want to proceed to a vote on the amendment, knowing that it may have an opportunity for further work and vote at further stops, or would you like to withdraw it?
Thank you, Mr. Chair. I'll withdraw the A37.
The A37 is withdrawn. Senator Rasmussen.
Thank you, Mr. Chair. I'll move the A30 amendment.
Senator Rasmussen moves the A30 amendment. Please describe your amendment while it is distributed.
Thank you, Mr. Chair. So the A30 simplifies the benefit payment formula, essentially the wage replacement. Currently, and just for members to know, the wage replacement is a key parameter of the paid family medical leave bill and determines a lot of the cost. Right now, the bill gives a very generous wage replacement, especially to higher income Minnesotans. So my amendment would cap the maximum wage replacement at 67% of the statewide weekly wage average, which right now is about $862 a week. For Minnesotans who earn $1,000 or less a week, nothing will change. They'll get the same benefit. But for those who have a weekly income of $1,007 increased, their benefit would go down. And the reason we're doing this is to help keep in line with the wage replacement in other states and help manage costs.
Senator Mann.
Thank you, Mr. Chair, Senator Rasmussen. So by adding this amendment and capping at 67%, we would be among the lowest in the country. Higher wage replacement is important for men to take leave, and that is that equalizer that we talked about earlier for gender disparities in the workplace, which is a very important thing that this legislation tries to address. And lastly, this decreases the amount that people are making at $52,000 per year. So this is hardly even middle class. So we are going to penalize those people. The basic cost of living in Minnesota for a family of four is $86,000. So by taking up this formula, we will continue to penalize not the lowest, but certainly lower wage workers. And so for those reasons, I would request a no vote.
Senator Rasmussen.
Thank you, Mr. Chair. Massachusetts has, I think, a 64% cap. And again, this isn't a cap on total wage replacement for those lower income Minnesotans. They would actually have a higher percentage of their wage. This just looks at that statewide average. So this is very in line with what other states have offered. And again, for anyone who earns less than $1,000 a week, their wage replacement won't be affected by this. And how the bill's written, for those who are earning less than half of the state average, they're receiving up to 90% income replacement. And so this is just, I think, a common sense amendment to limit the cost that this is going to have on the system and is well in line with other states. So I'd ask for members' support to the amendment.
Other member comments? The A30 is before us, and we will proceed to a vote. All in favor say aye. Aye. Opposed say nay. Nay. Amendment is not adopted. Senator Rasmussen.
Thank you, Mr. Chair. I'd move the A25.
Senator Rasmussen offers the A25 amendment. Please describe the amendment while it is distributed.
Thank you, Mr. Chair. I think this is a very common sense amendment. There's a lot of employers who today actually offer benefits that either match or exceed the monetary value of the benefits that would be required in this bill, but they might structure it a little differently. An example would be an employer that perhaps allows 10 weeks of leave at 100% wage replacement to their employees. And my amendment would say that for any employer that provides a leave plan that either matches or exceeds the monetary value of what's required in this bill, that they would be able to offer that plan to their employees. This is a common sense amendment. It doesn't penalize those employers that are already offering this type of leave to their employees, and it doesn't mess with the plans and the arrangements that they have with their employees. So I would ask for members' support.
Senator Mann.
Mr. Chair, Senator, so currently, Washington is the only state that has this language in their statutes. And the concern is that an employer can pay out the employee for the monetary value of their leave, but not give them the time off to be with their families or take care of their baby. And so then people say, well, then they can take unpaid leave or take FMLA. But the issue is that only 60% of people qualify for FMLA, so they don't even have the option to leave. And most importantly, of course, FMLA is mostly for higher wage earners and does not include most people of color. And so I would hate to find out that we put this language in and we have low wage workers that are being given partial pay and no time off. And so for that reason, I would request a no vote.
Senator Rasmussen.
Thank you, Mr. Chair. I will note that this language was actually in the original bill as introduced and in the paid family leave proposal that worked through at the House over the last biennium. And to address concerns at the federal level, there's already requirements for employers to offer leave. So if there was some type of cash out or even a higher monetary benefit under federal provisions, people could take that, would still be entitled to take that time off. And so I think this is a very common sense amendment. I think it's the work of our committee that we should be doing and would request member support.
Other member comments? The A25 is before us. All in favor, say aye. Aye. Opposed, say nay. Nay. The amendment is not adopted. Senator Rasmussen.
Thank you, Mr. Chair. I'd move the A28 amendment.
Senator Rasmussen offers the A28 amendment. Please describe the amendment while it is distributed.
Thank you, Mr. Chair. As this bill has largely been described as a 12-week leave program, one of the unique factors in this bill is that it could allow an employee paid leave for up to 24 weeks in a single year, which adds to program costs and also uncertainty for employers. The amendment that I have would limit the combined benefit duration to 12 weeks, plus an additional 2 weeks for leave related to pregnancy complications, so for a total of 14 weeks. This is in line with what we've seen in Colorado, Connecticut, Delaware, Oregon, and most states that have a paid family and medical leave mandate for employers. And so I think, again, this is another common sense provision, puts us in line with other states, and I think we'll make sure that when we're talking about a 12-week leave program, that it doesn't turn into a 24-week leave program.
Senator Mann.
Thank you, Mr. Chair, Senator. So Senate File 2 is fairly middle of the road when it comes to combined time off. 5 states have longer combined times. We also know that, we talked about previously, that most people do not take the full leave, right? Some states, they have 12 weeks, they take 8. Some states have 26 weeks, they take 12. And so it's not easy to stay at home getting part of your wages replaced, and that's why people don't take the full leave. And imagine if someone does qualify for 24 full weeks in a year. That means that they had a baby, and then something horrible happened, right? They had a baby, and then they had a stroke. So the vast majority of people will not qualify for 24 weeks, but when they do, it's something catastrophic. And we want to make sure that when these people are faced with the worst year, with the worst time in their lives, that they are supported. And I'll also note that 26 weeks is considered full postpartum recovery time, and that data supports 40 weeks as having the greatest impact on infant mortality. So the 12 and 12 that we're talking about is really quite reasonable.
Senator Rasmussen.
Thank you, Mr. Chair. And I would just point to, some of those states that I mentioned, they have a hard cap at 12 weeks. And, these are blue states that have pursued these types of programs. And, what I'd ask, Mr. Chair, just the bill author and the proponents of this bill to think about are just some of the cost parameters that I think could have this become one of the most expensive paid family and medical leave programs in the country. And I think this is, again, a common sense solution that would still allow for up to 14 weeks of leave for someone and would still have the 12-week leave in there as well. And so I'd ask for member support to help put this bill in line with the benefits other states offer.
Member comments? The A28 is before us. All those in favor say aye.
Aye.
All opposed say nay. Nay. The amendment is not adopted. Senator Rasmussen.
Thank you, Mr. Chair. I'd move the A38 amendment.
Senator Rasmussen offers the A38 amendment. Please describe the amendment while it is distributed.
Thank you, Mr. Chair. So different states have taken different approaches to administering their paid family and medical leave programs. One of the factors that I would like to see in this bill is allowing DEED and having DEED take a look at using third-party administrators to administer either part or some of this program. And Mr. Chair, one of the biggest concerns that I hear from constituents.
Excuse me, Senator. Members, we have a great number of people in the audience today, and there's a great deal of passion around this issue. I do ask that members of the audience do not interrupt the proceedings of the committee, and please be respectful throughout. Thank you.
Thank you, Mr. Chair. I appreciate that. And we've seen many states, whether it's been Connecticut, Colorado, New Hampshire, Vermont, use third-party administrators in some way to help manage cost while also delivering a high level of customer service to the members who are going through the claims process in these states. And so my amendment would ask DEED to evaluate using a third-party administrator for part or all of the administration of this program, and then DEED would still have the option of using a TPA or still keeping everything in-house, but this would allow them to evaluate it and present it back to the legislature what their recommendation is. I think, again, this is a common sense approach for us to look at what other states have done, think about what could be the most efficient, most cost-effective, without having a default be a new government-run bureaucracy and potentially another tech disaster from Minute. And so I'd ask for member support.
Senator Mann.
Thank you, Mr. Chair. Thank you, Senator Rasmussen. I appreciate the intent of this amendment, and I also appreciate the way you've gone about this process with me. So I understand that the idea of giving a project to a company that already does this so that we can save money sounds fantastic. However, when social benefits are privatized, cost savings very rarely materialize. And this is not a philosophical argument, this is data-driven argument, right? In fact, in many instances, after the privatization of services, the costs were so large that most governments had returned previously privatized services back to public control. The evidence we have dates back over 40 years, and it does not support the claim that privatization saves money. Because of this, governments around the world, again, are increasingly returning previously privatized services back to public control, and the top two reasons for that are insufficient cost savings and poor quality of service. One of the biggest goals in this bill is to decrease inequities we currently see in leave taking. The people with the least access are women and people of color. So if we keep that equity lens on, we know that private firms do need to make a profit. They have shareholders and board members that they have to answer to, and this means that when push comes to shove, they will only employ labor so long as they can profit off of that labor. So in order to lower costs, private firms historically pay workers lower wages and reduce the number of workers altogether. And as usual, the disadvantages are primarily felt by the workers in the lower paid positions, among which are women and people of color. Comparatively speaking, private sector employees are significantly less likely than public sector employees to have stronger benefit plans, including pensions and other forms of non-wage compensation. So the other thing we hear is that Minnesota has had so many problems with standing up public services, so surely the quality of services, when privatized, will be better. Again, not true. So first of all, DEED has already had significant institutional experience administering the unemployment insurance program and the frontline workers pay program, and is well positioned to build off of that experience to administer this program very successfully. Second, again, because of the need to maximize profit, firms will often lower wages, give out less benefits, and offer more precarious working conditions than the public sector. These conditions do lead to higher rates of turnover, less experience, and lower morale, all of which directly work against the conditions required to ensure a high standard of service delivery. As the wealth gap increases in this country, there is a reason why we have a workforce shortage. And so, as I mentioned before, the number two reason that we return services back to the government is poor quality of services. Now, if we want to talk just about paid family leave, we can learn lessons from other states, including Connecticut, which is the one state that has privatized their program. What Connecticut is seeing is that the program is actually more expensive, right? They are paying Aflac $1.9 million per month just to administer the program, in addition to the $1.4 million per month in-state costs to oversee Aflac and manage the appeals of the program. So this amounts to about 15.5% of benefits paid, which is more than double what we have in SF2 that sets the administrative limits at 7%. And we are also seeing significantly higher, which is that 15% is also significantly higher than what we see in other states. Colorado spent a whole lot of time trying to do a bidding process to explore outsourcing, and they eventually abandoned this approach because of the excessively high costs. And so lastly, large insurance companies, they're saying they can bid on the process, but for paid family leave, those companies would be out of state. And so if we outsource the administration of this program, we are going to take our taxpayer dollars to hire employees in other states instead of keeping jobs here in Minnesota. The government is accountable to the public. Private firms are not. And so they can prioritize profits at the expense of quality. And just look at our healthcare system, right? Also, nothing in this bill limits DEED from contracting out parts such as software systems, if that makes the most sense to them. And so, for all of those reasons, I would please request a no vote.
Senator Rasmussen.
Thank you, Mr. Chair. And, just to focus members on the language of the A38 amendment, this would simply give Commissioner Grove, as deed commissioner, the opportunity to evaluate what services he would keep in-house versus what he might be interested in evaluating with a third-party administrator. State government uses vendors all the time for all sorts of key critical services, including in the human services space. And in the amendment language, it talks about both cost and the service benefit. And so, I think Commissioner Grove wants to do a good job administering this program, and will take this evaluation seriously. I just want to give him the opportunity to come and do a study on this and send his findings to the legislature so we and the public know why he is choosing to keep things in-house, or why he is choosing to perhaps utilize the experience and the scale of another company that is doing this in other states. So I'd ask for member support.
Other member comments? Senator Howell.
Thank you, Mr. Chair. And I will echo what Senator Rasmussen says, because his comments, if you look back, I just remember the Minlars. And I remember talking to the commissioner, and because my daughter had just started working for Fast Enterprises. And she had been working in the Department of Revenue out in Montana. And I found out that our Department of Revenue uses services from Fast Enterprises. And she got moved from Montana to Massachusetts. She was working in Boston, and they switched her from the Department of Revenue Services to Department of Motor Vehicle Services. And she says, Dad, you know that problem you're having with vehicle registrations and vehicles? We do that. And I said, really? I said, can you connect me with the person that does the demos? And I passed that along to the commissioner, and I said, who would you like me to send this to? She said, send it to me. Well, 3 weeks later, I called her up and said, well, actually, I met her at a committee, and I said, how's that going? How was the demo? She said, I didn't take it. And I said, well, why wouldn't you take it? She goes, we're so deep into this, we got to make it work. Well, that was in April. In November, they hired them. So what I'm saying is, and then 4 months after that, or $4 million, or $14 million, however, $40 million, whatever it was after that we poured into trying to salvage that program, the Blue Ribbon Committee evaluated it, recommended it to Governor Walz, and they hired them to do the whole process, and we have them working in DVS today. Well, all this amendment does is it lays it out there and says, just do a blue ribbon panel. Go out there and take a look at it, and if it makes sense, do it. If it doesn't make sense, don't do it. Why wouldn't we take the time to evaluate that to ensure we don't go down that bad road that we did in Minlars, trying to salvage a system that doesn't work? I think this makes sense just to try to make it, to take a look at it beforehand, do the evaluation, and maybe save us the pain that we did one other time.
Other member comments? Thank you, Senator Howell. Thank you, Senator Rasmussen. The A38 is before us. Members, all those in favor say aye. Aye. Opposed say nay. Nay. The A38 is not adopted. Senator Rasmussen.
Thank you, Mr. Chair. I would move the A31 amendment.
Senator Rasmussen moves the A31 amendment. Please describe the amendment while it is distributed.
Thank you, Mr. Chair. This bill represents a really complicated math problem. And when we look at all the different parameters, whether it's usage, participation, what wages are going to be, getting the math right is really important. And unfortunately, one of the lessons learned from other states who have implemented paid family and medical leave is that sometimes we can be wrong. And right now in this bill, we're taking the proponents of the bill at their word that they think the premiums will be 0.7%. In other states, we've seen those numbers be wildly off. So this amendment would require an actuarial study before launch. We would just have actuaries, nonpartisan, Deed would commission this and contract with the actuary just to make sure the numbers work before we launch this program that Minnesotans are going to depend on to make sure the benefits are there, and Minnesota employers to make sure that their premiums are going towards the benefits that were promised. And so I think this is a really common sense amendment, something that should be done before we launch this large program that will affect employers and employees across the state.
Senator Mann.
Thank you, Mr. Chair, Senator. So there was a cost study done by the Department of Labor in 2016. That study was updated in 2019 and is being updated again. The data is solid, and we know that because, again, we know what has happened in other states where the same studies have been spot on or very close to what they launched. There is nothing in this bill prohibiting Deed from doing an actuarial study when they want down the line. But by adding this amendment, all we are going to make sure we do is delay people getting the help that they need. So I recommend a no vote at this time.
Senator Rasmussen.
Thank you, Mr. Chair. This will not delay. This actually requires the actuarial study to be reported back on October 31st of 2023, this year. This is well before the implementation date of this bill. There's plenty of time. It just would give us time if the actuarial study came back and that some of these assumptions were wrong. It would give us the opportunity as a legislature to fix it and make sure that it actually works for Minnesotans. And Mr. Chair and members, the goal of my amendments today is not to gut the bill. It's not to throw out this idea. It's really common sense amendments that match what other states have done to make sure that this actually works if we put it out for Minnesotans. And so on this amendment, Mr. Chair, I would request a roll call.
Roll call will be granted. Other member comments? Clerk will take the roll on the A31.
Chair Klein.
Nay.
Senator Seeberger.
No.
Senator Dames.
Yes.
Senator Duckworth.
Yes.
Senator Frantz.
No.
Senator Wicklund.
No.
Senator Howe.
Aye.
Senator Latz.
No.
Senator Zhang. Senator Rasmussen.
Yes.
Thank you. On the A31, there are 4 yes votes and 6 no votes, and the amendment is not prevailed. Senator Rasmussen.
Thank you, Mr. Chair. I'd move the A33 amendment.
Senator Rasmussen moves the A33 amendment. Please describe the amendment while it is distributed.
Thank you, Mr. Chair. Most states that require an employer contribution into a program like this exempt small employers from paying the premium. This includes states that have a similarly structured program, including Washington. And so this amendment would provide a dual path for employers with 50 employees or fewer. One, it would, for those that opt not to pay the employer portion of the premium, it would allow them to do so, which would exempt them from a cross subsidy that we oftentimes see going from small employers to larger employers due to higher usage rates of paid family medical leave programs. For those who decide to pay the premium, they would then be eligible for the assistance under Section 268B in this bill, which is about a $3,000 grant that would be given to those small businesses. So this is in line with what other states have, And for employers with 50 or fewer employees, would just make sure that they're not paying for the big employers and subsidizing the cost of their employees.
Senator Mann.
Thank you, Mr. Chair. So this would create a different kind of cross-subsidy where all the workers in the state would subsidize the smaller employers. We will need to increase the premiums because of that or decrease the payout because smaller employees make up almost half of our workforce. But most importantly, again, the people who work in smaller businesses, women and people of color. So again, we're going to leave out the people who need this the most. The exact population we want to make sure that we are including. And so I request a no vote.
Senator Rasmussen.
Thank you, Mr. Chair. And I'm sorry for any confusion in the amendment. Employees of companies that are 50 or fewer employees would still be included. They would still have access to all the benefits that any other employee would under the system. It's just in other states we have recognized that for employers with 50 or fewer employees, the small businesses, that there needs to be some flexibility when it comes to this program, and that we're not asking the small businesses who use this program less to subsidize the larger businesses who use it more. So no one will be left out if this amendment is adopted here today. All the employees for those small businesses will be included in the program. So it asks for member support.
Other member comments? Senator Latz.
Thank you, Mr. Chair. And Senator, I'm trying to understand, how would the employees in a small business then, they would still be covered even if their employer was not required to pay any premium? Can you explain to me how that would work?
Senator Rasmussen, will you yield?
Yes.
Senator Rasmussen.
Thank you, Mr. Chair. Yes, this is about the premium being paid into the program. And what we have found in other states is that oftentimes usage is lower for small businesses. And so there would still be the employee portion of the premium that would get paid into the program to cover the costs of those employees. And then for those employers who elected to pay the employer portion of the premium, then they would qualify for the grants that are already included in the underlying bill.
Senator Latz and then Senator Mann.
So, thank you, Mr. Chairman. Senator Rasmussen. So, an employer with under 50 would be completely exempt, but there's an incentive to get them to pay their portion. But there's no, you're not proposing any kind of a sliding scale or anything in there, are you?
Senator Rasmussen.
Thank you, Mr. Chair. Senator Latz, no, there would be no sliding scale. The cutoff would be 50 employees, which is consistent with how we define a small business in Minnesota and at the federal level, and is in line with what they do in Washington and other states.
I guess I'll listen to more, but I'm a little bit concerned about a cliff between 50 and under 50. I mean, if there is anticipated a hardship for smaller businesses, you know, maybe some sort of a sliding scale or an accommodation could be reached to deal with that. But a cliff like this, I'm a bit concerned about.
Senator Mann.
Thank you, Mr. President, Mr. Chair. So first, what we learned from other states is that small businesses have significantly benefited from this program and being involved in it, because now that's the only way that they can compete with larger businesses in offering these benefits. When we exempt them, we do them harm. There has been no data to state that small businesses will suffer because of this. And in fact, again, because of employee retention and being able to compete, they benefit. And again, if we do this, this is half of the workforce. We will have to increase premiums and decrease payouts because of lack of participation.
Other member comments. Senator Rasmussen. Oh, I'm sorry, Senator Howe.
Thank you, Mr. Chair. And Senator Rasmussen, this doesn't exclude those businesses under 50 from participating. It just, it requires the employee, it keeps the employees in the program. It just exempts the employers, those small employers under 50, from paying that fee. So it lessens the burden on the employers under 50 employees. But those under 50 employees, those 5, 10, 25, 30 employees, still pay their percentage and still participate in the program. Is that not, so they're still protected, is that not correct?
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Senator Howe. That is correct. The employees would still be participants in the program with my amendments adopted.
Thank you. Thank you, Mr. Chair. And so we're just protecting those small employers and trying to help them stay in business. Thank you.
Thank you, Mr. Chair. And I'd ask for member support, and you'll see in your packet, there's a letter from the Fergus Falls Chamber of Commerce, which represents many small businesses in the area that I represent. We'll also be hearing, I believe, from some of the testifiers who represent small business, their concern. And this is a new tax on all employers, and I think especially given the hardships that small business have been through the last few years, we should be really careful about putting undue cost on them, especially with the rollout of this new plan.
Senator Latz?
Yeah, thank you, Mr. Chairman. And Senator Rasmussen, I mean, if a small business has 3 employees, they're only going to pay 3 employees worth of premiums, right? If they got 49 employees, they're going to pay 49 employees worth of premiums, right? So we can't necessarily determine the ability of a small business to pay this premium based on the number of employees they have. You'd almost have to look at other factors. I mean, there are plenty of small businesses that have 2 or 3 employees that are making gobs and gobs of money because of the kind of business that they're in or the way that they operate. And there are plenty of businesses, I'm sure they're at 40 employees that are barely making, a net profit at the end of the year. And so I think it's kind of hard to judge the ability of a small business to pay by the number of employees that they have. So, I mean, I understand not wanting to overburden small businesses, but I'm not sure this is the right way to do it. And in the end, I'm not sure that it leaves the whole system financially viable if they're exempt in some way, if they're half the workforce.
Senator Rasmussen?
Thank you, Mr. Chair, and I appreciate Senator Latz's questions and comments on not creating a cliff. The idea where this comes from is really looking at Massachusetts, Washington, Colorado, Maryland, Oregon. Many of the states who have enacted a paid family medical leave program similar to this have looked at small businesses, have understood that there is a cross subsidy from small employers to large employers, and this is one of the ways to compensate for that. And so I'm hoping that we'll look at this going forward and make sure that small businesses aren't overly penalized and at worst would be subsidizing larger employers.
Other member comments? The A33 is in front of us. All those in favor say aye. Aye. Opposed say nay. Nay. No. The amendment is not adopted. Senator Rasmussen.
Thank you, Mr. Chair. That's all I have for amendments today. And I would just, comment that I think this bill needs a lot of work to make sure it's functional and to make sure that if this gets launched, that we know what it's going to cost and that we have parameters that are in line with what we've seen in other states. Right now, when you look at the benefit parameters of this plan, it's almost a best of best. It's taking the most generous benefits across a number of states and combining them together. And I believe that that's going to lead to an unsustainable plan. And especially, Mr. Chair, I was really concerned that we didn't take the amendment on the actuarial study. I don't know why this committee or this legislature would be afraid of knowing the math before we launch the program to make sure that it's sustainable. And so I hope, while we were unsuccessful today, I hope that members will consider how to make improvements on this bill. We'll be listening to the business community and be willing to meet with the business community and understand some of their concerns to make sure that if this does become law, that it actually works as it's been advertised.
Thank you, Senator Rasmussen, and thank you for your hard work on these amendments today, as always, trying to bring them in candor and open discussion to the committee. And thank you to the author for working with Senator Rasmussen on some of these ideas. Did you have any responsive comments to his, Senator Mann?
Thank you, Mr. Chair. So we have been working with the business community. We are certainly at the table with all the stakeholders many times per week. And so these conversations are ongoing, and this bill will need to go through several more committees, so there will be much more work to be done in the next several weeks.
Senator Rasmussen.
So, Mr. Chair, a question for the bill author. What committee will the work be done at looking at the sustainability of this plan and the benefit parameters?
Senator Mann.
Mr. Chair, we do work at every committee, Senator Rasmussen, and even things that you brought up today, I will work on in the next few weeks, and they will likely be brought up again at the next committee. So,
Are there other, Senator Howe?
Mr. Chair, Senator Mann, But this is the committee that deals with this piece of that insurance. So I'm concerned that it's in this jurisdiction that a lot of these amendments should have been taken up. And if the committee's not done in this, if the work's not done in this committee, it's not in the jurisdiction of many of the other committees you're going to go into. So how are you going to make those amendments in a committee that doesn't have that jurisdiction?
And before you go, Senator Mann, I just want to remind the committee, our jurisdiction actually is confined simply to Section 15, which is the substitution of private plans for this program. And so in point of fact, some of these amendments are not within our jurisdiction, although I did hear them here. And certainly there would be the opportunity for them to be heard in future committee stops. But Senator Mann.
Yes, thank you, Mr. Chair. So we are going through several more committees, 3 specifically, that will deal with the entire bill. So there will be plenty of chance to do the work there.
Senator Dames.
Well, thank you, Mr. Chair, and Senator Mann, just a couple of questions. First, the long-term care facilities, we know that they're in real financial crisis, and this is going to be an impact on these employees and employers to fund this process. So can you tell me, is the Department of Human Services, are they going to reimburse the nursing homes for this additional cost? Or is that burden going to be put on the nursing homes and the people within them?
And Senator Mann, I'll have you answer that question, and then if there are, I'll ask for further amendments. If there are not further amendments, I think we will go to testifiers before we get to member questions, but please respond.
Mr. Chair, so it's my understanding that DHS has had conversations about this and that their reimbursement formula has inflation and part of this also in their new formula. Don't quote me on that, but I believe that's what's happening, but I'll get back to you with a specific answer.
We'll follow up, Mr. Chair.
Senator Dames.
Who does know this? I mean, I think this is where the rubber's meeting the road. This is going to put these nursing homes in some severe straits compared to where they already are. And so for you just to say you think, but you're not sure, I understand where you're coming from, Senator, but this is a serious issue. And Mr. Chair, I just have one other question, and then I'll be done with my questions, if you don't mind.
Senator Dames, please.
The other question I have, Senator, is with the, there are employers that have had employees on leave during the busy season, and then they're unable to hire temporary work. So what they've done is they've taken the rest of the team, put additional work on those folks, and increase their pay for that additional work. Maybe it's called a combat bonus or whatever you want to call it. The question is when that, when the individual comes back from their family paid leave, are they going to be required to be paid the same bonus as the people that replaced them got paid because of the fact that they had to do more duties?
Senator Mann.
Thank you, Mr. Chair. So the bill does not state that at all. However, that is an employer, to the discretion of each employer, but that is not a requirement of the bill.
Thank you,
Senator
Madam
Dames.
Chair, or Madam Senator.
Members, thank you so much for the amendments. Are there further amendments from the committee? In that event, we will revert back to testifiers. And if I could call forward 3 at a time, please. Mr. Adam Dunnick, Dr. Eileen Crespo, and Alicia Jackson, please. Mr. Dunnick, please introduce yourself for the record and proceed.
Thank you, Mr. Chair and members of the committee. My name is Adam Dunnick. I'm the Director of Government Affairs for the North Central States Regional Council of Carpenters. Thanks for taking a moment to hear testifiers today. I'll do my best to heed your advice and keep it to within the jurisdiction of the committee. In other committees, I've spoken about how paid family leave affects the construction industry a little bit differently and how we've come at it and how the pandemic really impacted how our members approached paid leave. And so I'll leave that behind and move on to an important part that this committee oversees, which is jurisdiction over the Commerce Fraud Bureau and issues of economic competitiveness and fairness amongst contractors. So in the world that we work in, our members work in, there are really 2 kinds of contractors and business owners. There are business owners who pay their taxes, pay their employees well, pay unemployment insurance, carry workers' compensation packages and pay their premiums on time. And then there are those that do not. There are those companies that frankly have a sham business model, and they pay their workers cash. They oftentimes do not pay them. And what I would like to talk to this committee about, and what I continue to talk to the author about, I give Senator Mann a lot of credit for working with us in the trades on this, is how we make sure that this is administered fairly and right, and that it becomes a business fairness issue, because we cannot have a model where a bunch of employers pay into this paid family medical leave fund on behalf of their workers, and then there's a bunch of employers who do not, and they say they're independent contractors when they're really not. So I just urge the committee to continue to look at that. I applaud the Commerce Department for their work on that issue, and we'll keep working with Deed and others on this issue, but I wanted to raise that one in front of your committee today, sir. Thank you, Mr. Chair.
Thank you, Mr. Dunning. Dr. Crespo, please introduce yourself for the record and proceed.
Thank you, Mr. Chair. My name is Dr. Eileen Crespo. I'm the president of the Minnesota chapter of the American Academy of Pediatrics. On behalf of nearly 1,000 pediatricians in our state, I'm here to support Senate File Number 2. I'm a pediatrician, but I'm also the parent of 3 children. I know the stresses that come after welcoming a child into the world. I also know that a child's brain grows more quickly in the first 1,000 days than at any other time in their life. Studies have shown that children who receive consistent and responsive care from their parents in those first 6 to 12 weeks of life are far more likely to have positive physical health outcomes, improved cognitive development, and are set on an upward trajectory for the rest of their life. Paid family medical leave allows parents the necessary time to care for their children. This time not only creates stronger emotional connections between parent and child, but also increases the early identification of any developmental or other medical conditions. When these conditions are discovered early, medical professionals like myself have a higher chance of successful intervention, preventing long-term and serious health problems. The lack of paid family and medical leave has a disproportionate impact on disadvantaged populations in this state. 93% of low-wage and 94% of part-time workers have no access to paid leave. Additionally, more than 65% of Black and 75% of Latinx parents are ineligible or unable to afford unpaid leave. This bill will work to address the longstanding health disparities in these communities. Thank you for hearing my testimony today. No family should have to choose between a paycheck and the health of their newborn. I implore you to support paid family medical leave for all Minnesotans. Thanks.
Thank you, Doctor. And as you clear the table, if I could please have Mr. Dan Swenson-Klatt and Mr. Dan Quillen come forward. And with that, Ms. Jackson, please introduce yourself for the record and proceed with your testimony.
Yes, hi, my name is Elijah Jackson. I am the owner of First Class Cleaning Service. I am also a leader of Main Street Alliance. My business is in post-construction cleaning, which takes a physical toll. A few months ago, I had to have my gallbladders surgically removed and needed to be out of work for 3 weeks to recover. Unfortunately, I had to take an extra week and a half off. I went from working every day to all day to completely nothing, but my bills still had to be paid. If I was working in corporate America, I'll be able to take medical leave or even get assistance. Working as a small business owner requires me to perform many different jobs in one, and a business cannot run without me. On top of that, I have 2 children that rely on me as a single mother. I had to ask myself, do I shut my doors and take care of my health, or do I continue to show up and sabotage my recovery? Fortunately, if we pass the state-run paid family medical leave policy, that is not a question I would have to answer anymore. Paid family medical leave is good for business, and it's good for Minnesota, and the right thing to do. I urge the committee to pass Senate File 2. Thank you, guys.
Thank you, Ms. Jackson. Mr. Dan Swenson-Klatt, please introduce yourself for the record and proceed.
Thank you, Chair Klein, members of the committee. My name is Dan Swenson-Klatt. I've owned and operated Butter Bakery Cafe in Minneapolis since 2006. I also represent Main Street Alliance. You are hearing that the paid family medical leave bill might create a huge brand new expense for employers, or an assumption that employees don't need or use leave time, or that perhaps creating a leave bill that pays leave will incentivize my employees to all suddenly need 12 weeks off or more. As employers, we already pay for staff to be away, and it costs when they quit because there are no other options. We pay in rehiring, training, lost production, low morale, the need to fill in ourselves. It's already expensive, it's already chaotic. I offer earned sick time to all of my employees. In 2022, I paid 1,400 hours of sick time only half of it was earned. The rest came out of my pocket, out of non-existent business savings, my 20% credit card, an SBA EIDL loan, and wherever we could find it. The proposed bill, where I would pay a predictable small premium, is something I can budget for and something I would support. I need to let you know that I paid out $12,000 in paid time. A premium on my payroll, about $1,000. I think I'm going to save some money and get a benefit. I've been testifying for this bill for 6 years, every year a new story. This year, in December, my lead barista lost her father. She has needed several weeks to manage this loss. It would have been easier on me if it hadn't been during our slowest sales month, but death doesn't wait. Paid family and medical leave is the right thing to do, the right way to support small businesses throughout the year. Please advance Senate File 2.
Thank you, Mr. Swenson-Klatt. And as you clear the table, if I could have Imam Assad Zaman come to the table and Bailey DeVetter. Mr. Quillen, please introduce yourself for the record and proceed with your testimony.
My name is Dan Quillen. I live in West St. Paul. I'm a leader in Isaiah, and I'm a former DEED employee. A state-run comprehensive paid family and medical leave program, similar in design to our very successful unemployment insurance system, is a pro-family piece of legislation that fosters greater participation of women in the workforce. This is a concept that most civilized nations around the world have long realized. We need a way for small businesses to compete in the benefit area with larger companies that can offer this benefit. The answer is not having corporations dictate who is deserving and undeserving of paid family and medical leave. The answer is not listening to a handful of people who want to weaken this policy and turn it back into a patchwork of private insurance-based systems that leave too many individuals and small companies behind. Minnesota knows better, and our families know better. The key to keeping the cost low is creating a large statewide risk pool and sharing that cost between employers and employees so that everyone benefits. This legislation does that. Commissioner Grove of DEED has expressed confidence in his department's ability to build, design, and operate. As a former DEED employee, I am confident that the department has the ability to do so. I urge you to support Senator Mann's legislation.
Thank you, Mr. Quillen. Imam Assad Zaman, please introduce yourself for the record and proceed.
Thank you, Mr. Chair, Senators. My name is Imam Assad Zaman. I'm the Executive Director of the Muslim American Society of Minnesota. I live in Inver Grove Heights, Minnesota. I'm here to speak in support of paid family and medical leave. This is a core issue about the basic human dignity of all people. And the lack of access to paid time to care for oneself or a loved one deprives people of the ability to remain in the workforce and places them at risk of having to choose between a paycheck or taking weeks of time off to care for their loved ones or their families. God reminds us in the Quran, وَلَقَدْ كَرَّمْنَا بَنِي آدَمَ, and we have indeed honored the children of Adam on the land and the sea. And we have provided for them the good things and preferred them over most of the creation. Sadly, Senators, there are powerful interests here who are working to weaken this policy that would benefit Minnesotans across the state. This is a tactic to avoid ensuring that those who can afford it the most continue to not pitch in their fair share. We Minnesotans know better. Small businesses know better, as you have just heard. Families know better. We must reject any attempts to allow corporations to dictate who is deserving and who is not deserving of having paid family and medical leave. That would be un-Minnesotan. That cannot be what we stand for. So I urge this committee to vote yes to pass paid family and medical leave out of this committee today. Thank you very much for your time.
Thank you, Imam. And as you clear the table, could I please have Leota Goodney and Darcy McKenzie come forward? Ms. DeVetter, please introduce yourself for the record and proceed.
Thank you, Chair Klein and members of the committee. My name is Bailey Zalek DeVetter. I am the Director of Outreach and Faith Formation at First Presbyterian Church of Mankato, a resident of St. Peter, and a faith leader with Isaiah. As you may have noticed, I am also 35 weeks pregnant with my first child. Because I am the only full-time non-clergy staff at First Presbyterian Church, I unfortunately do not have any protections or guarantees for paid parental leave when this little one arrives in just a few short weeks. With our family's compounding expenses of hundreds of thousands in my husband's medical school debt, tens of thousands in loans to pay for the infertility treatments it required for me to get pregnant, and of course, impending hospital and daycare bills, it would ultimately make more sense for me to quit my job and provide our own childcare if my employer were not to provide paid leave, something they could understandably choose to do with a tight operating budget. I would absolutely hate to leave the work I love, but as things currently stand, this situation is the unfortunate and frightening reality for so many workers and employers in Minnesota. I cannot think of a better way to ensure all our neighbors are loved and protected than to enshrine their rights, our rights, to take care of ourselves and for loved ones without financial punishment. To support Minnesota's hardworking employees as well as small employers like mine, I urge this committee to vote yes for paid family and medical leave today. Thank you.
Thank you, Ms. DeVetter. Ms. Leota Goodney, please introduce yourself for the record and proceed.
Thank you for allowing me to address you. I am Leota Goodney. I am a retired certified public accountant and a retired small business owner in Northfield. And I'm also a leader with Isaiah. I am very much in support of this bill to make paid family and medical leave available to small business owners. I owned and am still employed by an accounting firm with between 5 and 10 employees. Over the years, 2 different employees have needed to take several weeks off to care for their elderly parents. 2 employees have had babies. And recently, a young mother had to take extensive time off because one of her children had developed severe mental health problems. With such a small workforce, 5 to 10 people, it is really difficult to pay someone their salary or a portion of it when they are out for extended periods, and also pay for temporary help or additional hours for other staff members to make sure our clients are properly served. The math just doesn't work very well. Under the proposed plan, the cost is spread out evenly over a long period of time so that it can be built into our pricing structure and budget. Good employees are hard to find. Having this benefit available will make it easier to attract and retain good employees and not lose them, as once happened, to a larger employer who already have such benefits. Many of the small business owners that my firm serves are in the same situation as our farmers of my acquaintance. We need to make it possible for people to work and take care of their families. It's time to pass this much-needed legislation to benefit small businesses and their employees. Thank you.
Thank you, Ms. Goodney. And as you clear the table, could I please have Nurse Marcanti come forward and Dana Bacon? Darcy McKenzie, please introduce yourself for the record and proceed.
Hello, my name is Darcy McKenzie. I'm a parent who lives in Mendota Heights. I started my family in my late 30s while I was working for an editorial firm. I really loved my job. Sadly, after my 2 oldest children were born, my employer offered no maternity leave. Then they no longer offered me any opportunities for career advancement. When my 3rd child was born, a daughter, I gave in and became a full-time stay-at-home parent. I do wonder, and maybe even sometimes dream, what could I have been? What contributions could I have offered? Recently, it was my husband who had to make a work-life balance decision. In the spring of 2020, the distressing and isolated early days of COVID, he had to move his 87-year-old mother from her North Dakota home into an apartment. Her health rapidly deteriorated, Her happiness, non-existent. Inevitably, Dane moved his mom into a nursing facility here in the Twin Cities. He cared for, then comforted his mother through her final days in hospice. He was only able to do this because his decision to exit the workforce and taking early retirement. I cannot imagine what it has been like for too many Minnesotans who went through what he did without that option. Passing paid family and medical leave really matters to me. These days, I've been thinking about my 2 sons who are currently serving in the U.S. Marines. They don't live in Minnesota anymore, but I want them to someday. I want them to come back home. They might want to come back if we can make a real commitment, a commitment to ensuring that Minnesotans can achieve a work-life balance and remain in the workforce. Passing of this will benefit all of us here. Thank you.
Thank you, Ms. McKenzie. And as you clear the table, can John Reynolds please come forward? And to the testifier at the table, please introduce yourself for the record and proceed.
Hi, thank you, Mr. Chair and committee members. My name is Allie Marcanti. I work as a post-surgical nurse in St. Paul, and I'm a member of the Minnesota Nurses Association. I've worked at United Hospital for the last 7 years and care for many patients who will need support at home once they are discharged. Daily, I see the effects of a lack of paid family leave in our community. Because family members need to work, elderly patients are unable to get adequate support at home and are forced to recover in a transitional care facility. The placement times lately can take days to weeks, lengthening their hospital stay and tying up beds for people needing more acute care. I also see the effects of insurance companies denying patients needed care for reasons that defy medical and humane logic. We know that insurance companies increase profit when they deny people coverage. Allowing a private company to administer this vital program means we, as taxpayers, are paying a likely out-of-state company that will be incentivized to increase wait times and add additional barriers that may prevent people from accessing a critical benefit when they need it the most. As a nurse, it's heartbreaking to see that money and profit are the reasons why patients are struggling to receive the health care they need. We need a guarantee that companies' bottom lines do not play a role in whether or not folks can care for their loved ones. We need a state-funded, paid family medical leave program. And now, here in Minnesota, we have the opportunity to look at how other states have implemented a publicly funded paid family leave program and take the best features from them. That's what this bill has done. In order to have the most beneficial and inclusive paid family medical leave option in Minnesota, this bill needs to be adopted and implemented in its entirety. Thank you.
Thank you, Ms. Marcanti. And as you clear the table, can Matt Hilgert and Alex Hassel please come forward? Mr. Reynolds, please introduce yourself for the record and proceed.
Thank you, Chair Klein. Thank you, Chair Klein and members. I'm John Reynolds, State Director for the National Federation of Independent Business in Minnesota. NFIB represents 10,000 small businesses in every corner of the state and every industry. Our average member is very small. They employ 10 Minnesotans and have $500,000 in annual revenue. I appreciate Senator Mann hearing our concerns with this proposal earlier this month and just now, and the conversations I've had with several committee members. NFIB opposes Senate File 2 in its current form. This proposal is an outlier in many ways among the states that have a PFML program, particularly in its treatment of small employers. It's no exaggeration to say that this will be one of the most expensive programs in the country for small businesses, and it will be nearly impossible for them to exercise the private plan option. First, the program's payroll tax is an added burden at a time when Main Street is still struggling. It amounts to about $1 billion to start, and with one of the most generous benefit payment formulas in the country and a 24-week leave duration, we believe the cost will rise quickly, perhaps even double in the first few years like Washington's. Second, as discussed earlier, most states allow small employers to opt out of the employer share of the premium while allowing the employee to still access the program. This includes the majority of states where the employer and employee split the cost of the premium: Colorado, Massachusetts, Maryland, Oregon, and Washington. In addition to the cross-subsidy correction referenced by Senator Rasmussen earlier, the opt-out also offsets the higher administrative burden borne by small employers that are generally starting further away from the bill's requirements and generally do not have layers of management that larger businesses have. Third, the combined benefit duration of 24 weeks exacerbates one of the biggest challenges facing small employers right now. A very high percentage of small businesses can't find workers. Several other states also offer 12 weeks of medical and 12 weeks of family leave. However, they cap total yearly leave at 12 weeks plus 2 to 4 additional weeks for limited circumstances like complications related to childbirth. Delaware has equivalent or shorter leave allowances, and Washington caps combined leave at 16 weeks with 2 additional weeks for pregnancy complications. The total combined leave matters because states with longer combined leaves have longer combined average leave weeks used per customer. The assumed average leave in the April 2022 fiscal note for a similar proposal was 6.6 weeks per person. If the real average leave was closer to Massachusetts' 12 weeks per person, the program cost would change significantly. Lastly, because the bill requires employers to restore an employee on long-term leave to their position, most small employers, especially ones whose jobs require extended training or skilled labor, will most likely have to leave the position open. They simply won't be able to hire a temporary or permanent replacement, even if they could find one. For our members, this means added stress on other workers, less ability to serve their customers, lower sales, and more uncompensated losses. We urge the committee to analyze carefully the parts of the proposal that will drive costs and protect Main Street employers and employees from explosive cost growth. Thank you for the opportunity to testify.
Thank you, Mr. Reynolds. Can Mr. Corey Anderson come to the table? And then Mr. Hilgert and Ms. Hassel, please introduce yourselves for the record and proceed.
Thank you very much, Mr. Chair. My name is Matt Hilgart. I work for the Association of Minnesota Counties. The association represents all of Minnesota's 87 counties. As members around this table recognize, counties across the state are engaging in a multitude of different collective bargaining units and agreements. The benefits negotiated in these collective bargaining agreements are distinct to each unit. So, for example, we have some local public health nurses who are asking for scholarship and tuition reimbursements. We have some plow drivers in St. Louis County who are asking for winter clothing allowances, and we have others who are asking for supplemental pension plans and more. Aside from these benefits, counties are proud to offer significant plans surrounding PTO, sick leave, short-term disability, and more, and I'd like to provide a few examples, if you don't mind. The average Blue Earth County employee has over 500 hours of PTO in addition to short-term disability and vacation leave. Again, that's the average employee in Blue Earth County. In St. Louis County, a couple collective bargaining agreements have negotiated sick leave accruals up to 1,900 hours. This is full salary replacement, and it is paid out upon retirement. So, for example, if you're working and making $30 an hour, that is a $57,000 supplemental retirement package and bonus at the end of your time with St. Louis County. Good for them, and that's fantastic. These are what these collective bargaining agreements are set up to do. Dakota County has a combination of PTO and sick time banks up to 1,000 hours. Polk County has 880 with an additional 320 hours of catastrophic leave. And Ramsey, Hennepin, and Wright counties have taken upon themselves in the last couple of years to collectively bargain versions of these benefits, paid family leave benefits themselves. This is a long way of saying that counties recognize that our number one asset, I want to be clear, our number one asset for our operations and helping Minnesotans across the state is our workforce. The concerns with this proposal are not just the intent, or the goals. It's more of the rigidity. Under Senate File 2, we have not identified one single county or package, supplemental benefit package, that would qualify for the private substitution plan, Mr. Chair, in Section 15 of this bill. In that case, local governments would be paying the employer tax, which would be another tax which we would most likely have to levy to provide, in some cases, duplicative benefits. And to that point, I'll end by just saying it is our hope that as this bill moves forward, there is some sort of recognition for employers that are doing the right thing and are providing current employees with very generous and robust leave plans. Thank you, Mr. Chair.
Thank you, Mr. Hilgert. Ms. Hassel, please introduce yourself for the record and proceed.
Thank you, Mr. Chair and members of the committee. Alex Hassel with the League of Minnesota Cities, representing 837 cities across the state. I'll echo a lot of what Matt said. He did a great summary of what we are looking at in this bill. And I'd also like to thank Senator Mann for being willing to work with us and having ongoing discussions on some of these pieces. But to respect the jurisdiction of this committee, I will limit my testimony to the piece related to that private plan authorization, though there are other provisions, as Matt said, that we're engaged on. As Matt shared, public employers offer many robust benefits in which they collectively bargain for, and this has been a long-standing tenet of local governments and has led to many generous benefits, often unique to the specific concerns and needs for various employee groups. This bill unfortunately does not currently give recognition to those benefits, some of which really do strive to achieve similar goals as this bill. Similar to counties, many cities of all sizes offer accrual upwards of 1,000 hours, and 1,000 hours is 25 weeks of leave for an employee's needs, which is similar to this bill. Cities from Bloomington offering up to 1,000 hours in addition to vacation leave. Cities to New Ulm offering more than 1,600 hours of accrued leave. We would like to see this bill authorize an employer to require the use of some of this time as it was intended to be used for these leave purposes. The way that this might be easiest achieved in this bill would be to allow this as an option for a private plan approval. Under the current proposal, an employee could utilize up to 24 weeks of leave and still have their entire leave bank. Not only is this a large financial liability for public employers to continue to carry, but it isn't using that accrued leave for its intended purpose. I do want to respect the committee's purview, so I'll leave it at that. But again, I appreciate Senator Mann's willingness to work with us on this, and I look forward to continuing those conversations.
Thank you, Ms. Hassel. And as you clear the table, let's have Lauren Schothorst and Andy Wilkie come forward. Mr. Corey Anderson, please introduce yourself for the record and proceed with your testimony.
Mr. Chair and members, my name is Corey Anderson, and I'm here representing NAFA, National Association of Insurance and Financial Advisors, two organizations with many members in each legislative district and more than 1,000 members statewide. So NAFA and Minnesota Association of Health Underwriters. I'm the owner and founder of DI Geek Insurance Agency, specializing in disability insurance. I've been in the business over 20 years, and I have 4 employees. Through the years, we have worked with over 1,200 clients, protecting the income of business owners and their employees, both hourly and salaried. I, along with the members of the Health Underwriters and NAFA, are opposed to Senate File 2 in its current form. Legislators need to understand that medical leave in the bill is the same as their short-term disability coverage. As a specialist in this area, I can tell you that the private sector has affordable short-term disability products available with very broad coverage for just about every group and individual. With many providers offering coverage for disability income, the market is competitive, so the prices are very affordable. Most employers already offer either subsidized short-term disability coverage to their employees or voluntary unsubsidized coverage where the employee has the option to purchase group coverage. To the extent that the employee is not opted for the coverage, they are making a value decision based on what works best for their personal needs. Since the advocates of this bill claim to have run into problems finding coverage, they may need to talk to another agent that has more expertise in these lines of business. That's what I do. The perception of a scarcity is not an accurate representation of our marketplace. What this bill does is put the state government in direct competition with private sector. This bill is a virtual market takeover by a state agency with no experience delivering this service or accurately pricing such a product. For instance, the current tax rate in the bill is lower than that of similar programs in other states whose coverage is much narrower. This points to the high likelihood of a large tax increase to fund the benefits promised. Legislators also have not considered the loss of tax revenue when private sector jobs are displaced, which includes loss of corporate income tax, personal income tax, and premium taxes. We recommend the following if you move forward with this bill. Let the private sector serve the market for short-term disability or medical leave. Mandate employers with over 50 employees offer short-term disability coverage and provide financial incentives for employers with 50 or fewer employees to provide that coverage to their employees. Outline more flexible minimum coverage requirements under private plans would qualify under the mandate. Focus the bill on providing a family leave program since there is not currently a well-developed private market. Recognize the employee shortage and the differences between large employers and small employers, which is those with 50 or fewer employees, ability to handle longer absences of key employees. Our clients and the public are not interested in another unfunded mandate that creates a $1 billion payroll tax on businesses and their employees. The public likes the idea of coverage. They don't like the idea of another tax shrinking their paycheck in a time of high inflation when the economy is moving towards a recession. Please vote no. Thank you for the opportunity to testify.
Thank you, Mr. Anderson. Ms. Lauren Schothorst, please introduce yourself for the record and proceed.
Good afternoon, Mr. Chair, members of the committee. My name is Lauren Schothorst, and I'm the Director of Workplace Management Policy for the Minnesota Chamber of Commerce, which represents more than 6,300 businesses and more than 500,000 employees. I am testifying in opposition to Senate File 2 as drafted. I say this on behalf of an organization where over 80% of our members offer paid leave in some form already. The business community is keenly aware of and also acutely impacted by not only the underlying set of issues we're discussing, but the policy proposals related to them. And this is why our members are telling us that Senate File 2 doesn't work for them, especially our smaller members who do not need or want this mandate to compete. It is too expensive and expansive, and its government-defined design is actually disruptive and punitive. Here's why. On expansiveness, this bill creates a mechanism for an employee to be away from their job for up to 24 weeks each year. At 44%, that's a considerable new standard. Not every employee will take off the entire time, but despite what we've heard earlier, experience shows that more time will be taken, and the bill as drafted almost guarantees more time off will be taken when combined with the definition of a family member, the expanded list of qualifying events, the enhanced wage replacement rate, and the stackability of the leaves in combination with the 80 hours of mandated sick time also moving this legislative session, making Minnesota an outlier, and our members are rightfully concerned. We also have a well-documented workforce shortage, and it's expected to get critically worse within the upcoming decade. In certain workplaces, such as hospitals or manufacturing facilities that run 24/7, or in daycares or schools where staffing ratios are carefully calibrated and monitored, we already do not have enough workers to fill in. Having such a specific and extended leave mandate disrupts existing benefits packages, but also unintentionally exacerbates problems related to our workforce challenge. On expensiveness. Minnesota already imposes a higher cost of doing business than many other states. You may not know that as it stands now, we rank 45th, nearly the last in business tax climate. So we have less ability to raise taxes than many other states and directly compared to the few states that have already enacted a paid leave program. We often hear from proponents that other states have done this and it's not expensive or a big deal for business. We disagree and are highly critical of imposing a new payroll tax on every employer that will collectively cost nearly $1 billion annually to create a broad new state-run insurance program that takes over an existing market and thwarts an emerging one. On that, we are also extremely concerned that an outside actuarial analysis has not been conducted and cannot comprehend how policymakers would reject a simple opportunity to sensibly legislate. We don't even have a fiscal note yet. Based on preliminary review, without modifications to initial scope and design, we expect the program to run into solvency issues. As we have seen, the payroll tax rate set forth in this bill has already increased from 0.6% to 0.7%. But we do commend the author for accepting Senator Rasmussen's amendment today to cap this payroll tax. Businesses can't adequately prepare for this type of uncertainty and tax liability, as we recently saw with the UI Trust Fund solvency crisis. So this change is good. This is a big, complex proposal, and we have significant concerns with the way it is drafted and structured. Increased costs further limit resources available for employee compensation, job growth, and expansion in Minnesota. In its current form, Senate File 2 would impede Minnesota's competitiveness and economic growth. But there are different approaches, and we encourage you all to keep working with stakeholders to find a better, more targeted, and sustainable solution, and address those issues relating to its cost, its size and its scope, its solvency, and the workability of its construction. We appreciate the opportunity to share our opposition and concern with the committee, and would also like to point out a handout submitted on behalf of the United for Jobs Coalition, which is over 80 statewide organizations also in opposition to this bill as drafted. Thank you, Mr. Chair.
Thank you, Ms. Schothorst. And as you clear the table, our last two scheduled testifiers could please come up, Gavin Hansen and Casey McGregor. Mr. Andy Wilkie, please introduce yourself for the record and proceed.
Thank you, Mr. Chair, members of the committee. My name is Andy Wilkie, Director of Business Development and Public Affairs at Greater Mankato Growth, the Chamber of Commerce and Economic Development organization with more than 900 members, including businesses, cities, counties, colleges and universities, and our local school district, and also at least one senator in this room for the last 30 years. Greater Mankato Growth is also part of the Minnesota Chamber Federation, a collection of more than 50 local and regional chambers of commerce from every corner of this state. Thank you for the opportunity to testify today. Greater Mankato is a growing, dynamic Greater Minnesota metro hub with a large trade area that includes 22 counties in southern Minnesota. A couple of highlights. Among all Greater Minnesota metros, Mankato has the highest rate of retail spending per capita. You're home to more than 25,000 college students, and we are the green seam. Agriculture is at the core of our economy. More soybeans are processed in Mankato than any other city in North America. To the proposal before us, all of our members sympathize with many of the goals of this legislation. However, they are also very concerned about several elements in its current form. On its face, it represents a vast new billion-dollar program that imposes a new tax at a time when our state has a record $18 billion surplus. It also imposes a significant administrative burden on all employers, large and small, public and private, many of which are small business owners who wear many hats just trying to survive each day. Further, and most important, this bill will further interfere with an employer's ability to tailor benefits to meet the unique needs of their business. A one-size-fits-all approach ignores the diverse needs of each employer across the state. Employers in Mankato are already meeting the moment, investing in their employees with increased pay and benefits. Our members understand that their employees are their most valuable resource. They are already doing everything they can afford to provide their employees with benefits. When surveyed, 4 out of 5 of our members oppose a state-mandated paid leave program. However, 2/3 of our members would support a program that creates incentives for employers to offer some sort of paid leave program. In this committee, we've heard our local government partners, cities, counties, and schools are facing yet another unfunded mandate that would likely lead to increased property tax levies. The result? Business and property owners will get hit with increased taxes, not just once on payrolls, but an additional 4 or 5 times with increased property taxes. Minnesota has much to be proud of, but future success is not guaranteed. Adding burdens and barriers to employers could have negative unintended consequences on our future growth. We urge you to work with business, industry, and your colleagues here in the House and the Senate, if you improve this bill, to avoid creating undue burdens for employers, especially small businesses. Thank you.
Thank you, Mr. Wilkie. Gavin Hansen, please introduce yourself for the record and proceed.
Thank you, Chair and members of the committee. My name is Gavin Hansen, and I'm here today on behalf of the Minnesota Business Partnership, which represents many of Minnesota's largest employers. Let me first say that members of the Minnesota Business Partnership support paid leave policies. We support them because it is the right thing to do for employees and their families. In addition, and as Commissioner Grove said earlier, in today's ultra-competitive workforce, providing paid leave is essential for attracting top talent locally, regionally, and globally. As a result, our membership already provides very generous paid leave benefits to their employees. In fact, many offer a more generous leave than what this bill prescribes. However, the bill before you today would make it extremely difficult for these businesses who already offer paid leave to offer a qualified employer plan, even if their paid leave benefit program exceeds the minimum requirement that is currently outlined in the bill. These issues include an expansive definition of family, no cap on 24-plus weeks of leave, and the brief window of 90 days required before eligibility for this program. Our concern at this stage is that the current paid leave medical proposal, as written, will harm our employees. It would disrupt existing employee benefit plans and force employees into a state-run program offering reduced benefits while facing the added burden of a new payroll tax taken out of their paycheck. Furthermore, employees are currently able to contact trusted human resources professionals at their place of work with questions. This program would replace that reliable service and force the employees to call a state agency to access paid leave benefits. Our members currently offer paid leave as a benefit to their employees, but this proposal creates a system that is burdensome and unfair to the employee, the opposite of its stated goal. We respectfully ask committee to consider a benefit program that is easy to administer and doesn't punish employees who already receive a comparable benefit from their employers. The Minnesota Business Partnership and our members are prepared to work with you to find a path that helps expand paid leave benefits to employees who don't have access without harming the many employees who already do. Thank you so much for your time.
Thank you, Mr. Hanson. Ms. McGregor, please introduce yourself for the record and proceed.
Thank you, Mr. Chair. Casey McGregor. FS2 kills the American dream. I encourage you to go listen to my House testimony. I do not take enjoyment in sharing my personal information, but it is the only way I know how to effectively communicate with you. I'm not trying to compete with anybody or compare my lived life experiences. We all have our own truths in this world. For those of you that are speaking in favor of this bill, I can relate and empathize with you. I shattered my ankle. A few months later, my nephew, 22 days old, died, and I missed a lot of work. And I came back after those 2 months in my life, and I had to survive. So I have an $18,000 HELOC. As I was crawling back onto my feet 3 months later, my best friend, 42, went into hospice with ovarian cancer. I was sitting in her hospice room as she was dying when Governor Walz closed my business. I understand what it's like to be without income. I now have a $33,000 SBA loan because my PPP loan was based off of the worst year of my life. I still oppose SF2 as it kills the American dream. Do you know what you're compensating and giving up in order to have Family Medical Leave Act? Having no cap at 0.7% payroll is a huge problem. Solely as the Family Medical Leave Act account drains, payroll tax percentages have to rise. Those that are in favor of this bill, any of your families own or work for small companies, blue or red, this bill affects you. Is a big demand on the company's capital. The House author said many times, Minnesotans work hard and dismiss the fear that people will take advantage of this. I disagree. It is human nature to take the path of least resistance. Quote from a restaurant owner, March 2020 was filled with immense worry. Businesses were forced to close. We felt as we were a deserted island left to the wolves. Quote from a gym owner, the damage the shutdown did financially and mentally is something we're still trying to recover from. I am a non-essential business owner. There are a lot of people that are still very angry. Why would you assume hardworking Minnesotans would work for you and not just pack up and leave? If you haven't noticed, thousands have. Haven't you done enough to destroy small businesses? Why does the state of Minnesota hate small businesses so much? Please vote no on SF2. Give small businesses their dignity back. And let us stay hardworking Minnesotans. SF2 is an American dream-killing bill. Thank you.
Thank you, Ms. McGregor, and to all the scheduled testifiers. Are there any members of the general public who would like to testify before the committee? Seeing none, are there any questions from the committee for the testifiers? Senator Frentz.
Thank you, Mr. Chair, and thanks to the testifiers. You know, I'm struck by a little bit of the contrast in the information we've had presented, and I honestly would like to present a question to Senator Rasmussen just to sort of identify some cost issues, if that's all right.
Go ahead, Senator Frentz.
Senator Rasmussen, there's been testimony, of course, that private employers often offer this type of benefit already, and certainly want to be respectful of the testimony from business owners and those that represent business owners about what is already being provided. Chamber testified that over 80% of its members already provide a benefit like this, and I'm sure you and I can imagine a company that provides an identical benefit. Can you tell us in percentage terms what those private companies might be paying now that are producing an identical benefit? 1%, 2%? Can you give us some idea, Senator?
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Senator Frentz, for the question. I don't have the specific costs of what those are to the companies, but I think one change that really needs to be made to this bill that unfortunately this committee rejected today was for those employers who offer either benefits that have the same monetary value or actually exceed, are more generous, that those plans would no longer work. And we didn't just hear that from the private sector, we actually heard that from the public sector today too, that their more generous packages do not fit within the rigidity of this bill. And I think we don't want to take those employers that are acting in good faith and trying to offer competitive, generous benefits, allow their employees to have time with a newborn baby, to allow family to have time when a family member is sick. And I think this bill, as drafted, doesn't allow that flexibility.
Senator Frentz.
Thank you, Mr. Chair. Well, thank you, Senator, but I'm actually going a slightly different direction. My question is, if we have an employer who is already providing this benefit, that's a good thing. We're recognizing the benefits to the family. I think the question is, does this bill increase the cost for that employer, or is it the same, or is it less? In other words, what we're trying to measure here is any additional expense to the employer, and if, for example, the cost to that employer is 35 cents on the dollar, 35 cents on $100, are we changing that? I presume we can agree, Senator, that if the cost is the same to that employer, that what this program would do is simply replace the existing benefit package. Is that fair?
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Senator Frentz. And it's really complicated to know what that cost is going to be, and it's really going to differ by employer because their employee base has different characteristics. And so some are going to be higher users, some are going to be lower users, for a whole variety of reasons. And so it'll really be a company by company analysis on if this, could potentially save them money or if it would cost them more. I would just, Mr. Chair and Senator Frentz, whether it was hearing from the folks that represent small business across the state, and they very clearly have concerns that this will cost them more, even for their members who actually offer these programs today, including the public sector employers we heard from.
Senator Frentz. Senator Duckworth.
Thank you, Mr. Chair. And just to piggyback off the last conversation quickly, as a small business owner, it will cost me more. I just have a few questions for the bill's author very briefly. But before I do, I want to reiterate that obviously the idea of providing paid family medical leave or paid family leave is a noble cause. There's no doubt about that. That's why I think many businesses in Minnesota are doing it in some capacity. We really have two different schools of thought on how we might approach this. I won't argue against the merit of paid family or medical leave. The question is, how do we do it the best way possible here in the state of Minnesota? And that's why my questions really come from the perspective of a small business owner or somebody out there who's going to try to have to figure out how they're going to implement this at their place of business and for their employees. Some of the bill talks about remote workers. So one of my questions is, if somebody is a remote worker, they work simply from their home here in the state of Minnesota, but the business is out of state, is that business going to have to participate in this program and deal with the implications of it?
Senator Mann.
Mr. Chair, so just to briefly go back to the previous conversation, the question about the providers who already offer this kind of leave, and they're more generous than what's in the bill, they can opt out. They don't have to participate in this. And if their benefits are more generous, then they will meet the requirements. So I'm not quite sure I understand that argument. If they have the leave, it's more generous, they can opt out, and there it is. And also, I would like to reiterate that 25%, we hear every organization come up here and say most of our employers offer this. 25%, a quarter of employees in Minnesota have access to family leave on this day. So, having said that, so if you work in Minnesota, you are part of the covered employee, and there's language about that, covered employment in subdivision 13. I don't have the latest copy of the bill.
Mr. Chair, if I may.
Senator Duckworth.
Thank you. I'll be more specific with my question and my concern, I guess, and it's this. The way that I read some of the language in the bill would lead me to believe that if a business is in another state, don't have a physical presence here at all, however, if one of their employees who may work from home or resides in Minnesota would require that business to participate in this program, at least in the capacity of that employee. And the concern I have is, let's say there's a business located in Hudson, Wisconsin that maybe employs folks here in Minnesota or any number of our communities that border the state. What I would hate for us to put in place potentially is a bill that disincentivizes that employer from hiring people in the state of Minnesota because of some of the language in this bill and how it's written.
Mr. Hudala.
Thank you, Mr. Chair and Senator Duckworth. So I'm just pulling up the specific language of covered employment that the bill's author referred to. And I believe it directly addresses your question. Specifically, It states that it includes an individual's entire service performed within or without, or both within and without the state, if either one, the service is located in the state. And I don't think that point is getting to what you're talking about, where you're located out of the state. So then the second part of that is, or the service is not localized in any state, but some of the service is performed in this state. So my understanding is that if the employee service is entirely based, say in Wisconsin or Iowa or whatever it is, then they would not fall under the definition of covered employment. But that being said, if the service isn't located in any state and part of the services do take place in Minnesota, then they would be covered. But perhaps the bill's author has additional details to provide on that piece.
Ms. Fitzpatrick.
Yes, thank you, Senator Klein. Senator Duckworth, this definition of covered employment comes from Washington State. And so, again, we are working to understand how other states have figured out the situation around remote work. Obviously, this is an ongoing challenge that we have with a lot of different kinds of benefits now, probably exacerbated during the pandemic. But again, we're looking to these other states for, how to manage that type of situation. Again, building on Washington State.
Senator Duckworth.
Thank you, Mr. Chair. I appreciate that. I totally get and appreciate that obviously the bill may be a little bit of a work in progress, and I hope that we do make some improvements along the way. A part of what's included on page 9 references the individual's residence is in the state. And I would just say I think that does come into play a little bit when we're considering where somebody might work and how this program might apply to places of business outside the state. So as long as we are in earnest looking at addressing that or making sure that it won't potentially be an issue, I greatly appreciate it. There is another portion of the bill that talks about overpayment. If a employee were to be overpaid by some sort of miscalculation, it says the department has a 2-year period to recoup that payment. And I'm just wondering what that looks like. Is there an appeals process? What would that employee, what would they expect from the department? Are they going to have some sort of, are their wages automatically going to be deducted in that amount? How is the expectation that the overpayment and any interest would be collected from that employee?
And Senator Mann, before you answer, I just want to ask the question at this point. We're at 2:25. The adjourn time for this committee is 2:30, but we certainly can go beyond that. It's an important issue, and we should honor all relevant questions. But I want to give members an expectation of what sort of time commitment we're asking for here. Senator Duckworth, can you give us a sense of how much further you plan to question on the bill?
I think I have only 3 or 4 more questions,
Okay.
Mr. Chair.
Senator Mann.
Thank you, Mr. Chair. I think we can have Deed answer that question.
Welcome to the table. Please introduce yourself and proceed.
Thank you, Mr. Chair, senators. My name is Evan Rowe. I'm Deputy Commissioner for Workforce Services and Operations at DEED. I'm replacing Commissioner Grove. To the question, I think there's a variety of sort of administrative remedies that DEED has used in unemployment insurance that I think could be comparably used in the administration of this program. I think there's civil remedies and other such things that we use in that regard.
Senator Duckworth.
Thank you, Mr. I guess could you give me an example as wage garnishment, how you would typically go about it, or?
Yeah, I'm sorry.
Mr. Rowe.
Mr. Chair, Senator Duckworth, that's absolutely an example of the type of approach that the program takes.
Okay.
Senator Duckworth.
Thank you, and thank you very much for that. I appreciate it. Another question I had related to, I'm just trying to, in my mind, play out how I would handle this, because I've had to work with employees that have family situations that arise. If I'm a business owner, I have an employee who takes qualified medical leave to help assist a family member through an emergency, which is a good thing, and they could be gone for up to 6 months depending upon qualification. And I hire somebody to backfill that person and do their role, and that person also qualifies or accumulates the benefit, and for whatever reason there's an emergency, they also have to go on medical leave. the way the bill reads, at a certain point, I would be required to rehire or basically ensure that those people have those positions when they come back. So my question is, as it relates to somebody who's maybe brought on to backfill somebody who specifically went on medical or paid family leave, and that could happen once, twice, maybe 3 times, is the expectation that that business owner is also going to be required to welcome that person back with the same level of full employment?
Senator Mann.
Mr. Chair, Senator, so first, in that example that you gave, that person would only qualify for 12 weeks, not 6 months. And you only have 12 weeks in a year to take care of a medical issue. You can't keep taking 12 after 12. Second, if that employee has worked for you for 90 days, then they do have job protection. So when they come back, their job should be protected. If you have a person who is filling in for that person, they likely will not be filling in for 90 full days. So they will not have job protection, and you would not have to rehire the second person and give the first person their job back.
Ms. Fitzpatrick.
Senator Klein, Senator Duckworth, also the reinstatement language is very similar to FMLA in that if it's a time-limited position and they would have ended their time with you, you are not required to keep them on. So in that situation where you're bringing somebody on temporarily to fill in for somebody that's on leave, presumably that's a time-limited position with you. So those employment protection pieces wouldn't, that reinstatement right, it doesn't exist there in that
Senator
case.
Duckworth.
Thank you, Mr. Chair, and thank you for the information. I guess I would, the scenario in my mind would take somebody beyond that 90 days if they're a backfill. Somebody goes on medical leave maybe, and then another situation arises in which now they're using the additional 12 weeks for a family situation. I've had that person on for more than 90 days. They now qualify. They use it. I guess what I would be wondering is if there's the ability to add some of that clarity or specificity to the bill that spells that out, because as somebody that maybe doesn't have some of the knowledge that you already have, it would be a question I would ask, and I think maybe an employee would think they're potentially entitled to, and that's why I raise it. The next question, if I may, Mr. Chair, I'm curious, when putting together this bill specific to paid family leave, paid medical leave, we have an experience rating with unemployment insurance that seeks to sort of match how often that benefit might be used by a particular small business. For example, I get a rating every so often. It gets updated and changed based upon how much employees of my business were to utilize that benefit. I'm wondering why an experience rating that varies depending upon usage has not been the route that's been pursued, and rather it's been an across-the-board, regardless of usage approach.
Ms. Fitzpatrick.
Senator Klein, Senator Duckworth, I think, obviously employers, as we've discussed, don't have a lot of control over whether a worker is going to need one of these leaves. So, again, the idea that we would penalize an employer by having them pay a higher rate because their workers actually use the program doesn't seem to make a lot of sense in this context. Obviously, in the UI context, the idea is we're using that rate, the rate going up and down is sort of a disincentive to lay people off. In this context, again, the employer really doesn't have a lot of control, and we wouldn't want to create a scenario where employers are discouraged or trying to discourage their workers from from using this benefit that they've paid into this system. And, again, there are many benefits both to the employer and the employee of being able to access this wage replacement. It frees up that employer from having to cover those wages potentially while that worker is out, freeing up that money to pay overtime or hire a temporary worker. So again, we don't want to, in this premium model, want to discourage use of the program.
Senator Duckworth.
Thank you, Mr. Chair. As you have heard from many cities and counties and maybe even some school districts, I just want to ask you the question if those are stakeholders that really truly are working with to try to hear their concerns and how it might play out or be implemented by them. And the reason I ask is I represent the city of Lakeville, among other fine places here in the state of Minnesota. Some of our largest employers are the school district, the school bus service company, and the city itself. And when I look at a program like this and I hear the concerns from some of these places who might already have good programs in place, I can only help but kind of see it to its fruition, which is the likelihood that we're going to see potentially fairly significant property tax increases that would come at the expense of some of these programs, despite what some school districts, counties, and cities might already have in place. So is that something that you are continuing to work with in regard to them, or is what we see in the bill likely what we're going to get at the end of the day?
Senator Mann.
Mr. Chair, Senator, wonderful question. So I have sat down with the vast majority of the people who spoke today, and I am having continued meetings with many of them. We're not seeing a property tax increase in other places, which is reassuring. But again, we are trying very hard to see the program from all aspects. And so, yes.
Okay.
Senator Duckworth.
Just a quick closing comment, Mr. Chair. Thank you. I would harken back to the conversation that was had earlier in regard to, is there an additional cost for an employer? And I'll use myself as an example. I have an employee who's phenomenal, and her husband had a medical event that has caused him not to be able to work. We had a conversation with her, and we said, you take the time that you need, your pay will not be impacted, and you take care of your family. And right now, I don't have any other additional cost associated with reaching that agreement with my employee, other than I'm honoring the fact that we're going to continue to compensate her. With this law coming into place, I would have an additional cost. It's not to say I wouldn't still do it, but I would also be paying some additional cost as it pertains to this bill. And one thing that I think we all need to have consideration about is the flexibility that employers and employees have to make decisions regarding benefits or situations specific to them and how it best meets the needs of that employee and their family situation. And that's a cause for concern I have in regard to how potentially rigid this bill might be in the lack of the potential for some flexibility as it relates to business owners and their employees. So I'm hoping that the several valid concerns and reasonable suggestions that were offered ultimately do make their way potentially into the bill. I hope we listen to those stakeholders to create the best possible bill. And a full room of folks and stakeholders is usually a good indication that feedback and thoughtfulness will be paramount to the ultimate success of this bill and for the state of Minnesota. So I thank you for the work you've done on it and bringing it forward. It's an important issue, and I hope at the end of the day we can make it the best possible version. Thank you.
Senator Mann.
I just want to comment on that. Unfortunately, not every employer is as open and giving as that, right? And then two, I would argue that you are incurring a cost because you are paying for a full-time position that it's open, right? And under this bill, you would not be incurring that cost. So give and take.
Senator Dames.
Well, thank you, Mr. Chair. And Senator Mann, just to follow up a question. Earlier, I had asked you a question about if an individual had taken, went on leave, and so the firm, unable to hire somebody else, would just have a couple of other employees fill in and work extra hours and do things like that, and they would give them a bonus. And you had stated that they would not, and so then my question was, when the person came back, would they be eligible or need to be paid that bonus? And you said they wouldn't need to be. During the testimony, I was going through the bill a little further because I thought I saw something in there. And on page 35, line 35.7 and 35.8 indicate that that person would be required to be paid that bonus. So if you wanted to take a peek at that and maybe explain where I'm misunderstanding it or clarify that?
Yes, I will take a peek at that. I also found the answer to your other question.
Senator Mann.
Thank you, Mr. Chair. So the nursing facility, medical assistant, and private pay daily payment rates are based on the cost the facilities incur, which include this premium. And so therefore, the nursing facility employer portion of the premium costs would be reflected in the nursing facility daily payment rates.
Mr.
Well, we'll
Hudal.
come back to that. If you could answer this question,
Yes.
and I'll come back, that causes a question on that.
Okay.
Mr. Hudala.
Thank you, Mr. Chair and Senator Dames. My reading of that provision, it states that the employee must have the same or an equivalent opportunity for bonuses, profit sharing, and other similar discretionary and non-discretionary payments. My interpretation would be that those bonuses would be for services, similar services provided. And so on the one hand, you have a employee who would be on leave and other employees who are presumably working extra hours or picking up extra shifts. And that's where the bonuses are coming from. I believe that's the crux of your question.
Correct.
And so I agree that perhaps the language, the same or an equivalent opportunity for bonuses, is a bit ambiguous. I think the better reading of that, however, is that the distinction between one's on leave and others are picking up additional shifts creates enough of a distinction that perhaps they are not actually eligible for those bonuses.
Is that something we should not clean up as long as the bill is not enacted yet? Maybe we should clean something like that up. It's just a thought, Senator Mann, as you go forward. Going back to the nursing homes, so you're saying it'll be added into the Medicaid payment. However, is it going to be added in at 100%? Or is it going to be say, this is what an average should be, so we're going to give them this, and we're going to find rural Minnesota underpaid again like we usually have been with Medicaid? So that would be my question. Is it going to be 100% paid? Or is it going to be some ratio that's going to be used that's probably not going to 100% pay it?
Senator Mann.
Great question. I would have to have further discussions with DHS about that, but certainly we would not want to impose that on rural communities. And also, thank you for that catch on the bonus pay. I will make sure we clean up that language so it
Thank you.
reflects our intent.
Thank you, Senator Mann.
Senator
Mr.
Dames.
Chair, I do have a question for you. I think this is the 5th committee now that we've heard, this bill has been heard in, is that correct? So did you just forget to hand out the fiscal note today, or have we not received a fiscal note yet?
Senator Dames, we do not yet have a fiscal note. I will send that question to Ms. Grunwald-Noldner to describe when we requested one and where it is in the process.
Thank you.
Mr. Chair and members, Senator Dames, the fiscal note was requested, I'd have to look at the date when it was requested, but it is in the process of being completed, and staff is in communication with the Legislative Budget Office and agencies to keep that moving.
Thank you.
Senator Dames.
That's all I have, Mr. Chair. Thank you.
Other member comments or questions? Senator Howell.
Thank you, Mr. Chair. And, you know, today I had an opportunity to meet with our community ed folks. And we discussed this bill somewhat. And, you know, in community education, they hire a lot of community members, and for their after-school programs, they hire a lot of high school kids. Their concern is that increased cost that's going to be passed on along to them, and the high school kids that will actually, I have to believe, unless there's something else in here that I didn't see, they would qualify for that benefit, would they not?
Ms. Fitzpatrick.
Mr. Chair, Senator Howe, again, if they are working and they're paying into this system as a function of being part of the labor force, they are included in the program. I think, you know, we think a lot about young people, you know, working to buy sneakers or something, but a lot of our young people are working to pay for college. They're working to help support their families. And so I think, again, they'd have to have a qualifying condition that meets the requirements of the bill. But if a young person in your community was counting on that income that they get from being part of the community ed program to pay their college tuition or to save up for their college tuition, and they had, again, maybe they tore their ACLU or whatever, it's not ACLU. ACL. I'm not a sports person, you can tell. You know,
That
and
happens
track practice, right? And they, you know, couldn't be, you know, do that job. And so, again, I think you know, their wage replacement would be based on their wages. And so, you know, again, if they're earning part-time wages. But again, I think, you know, the idea is they're paying into this program. This is an earned benefit. Those young people are also paying in to be able to, you know, have this kind of economic security when they need it. So that would be my response.
Senator Howell.
Thank you, Mr. Chair, and a follow-up. So the concern is most of those community ed programs are based upon what their cost is and a little, just to make the ends meet. And what is happening is as these costs rise, we're actually making it so those lower income families can't afford to participate in our community ed programs. And so my concern is we're going to continue to raise the cost, and we're going to price these folks right out of the market of being able to participate in our community ed and our after-school programs. And that's part of the concern is there's no, we're going to cover everyone, and we don't give that out for those small employers. We don't, you know, that they can still maybe cover the employee, but we don't give that out to those small employers that can continue to participate and provide the deal, but we don't have the employer pay that side of the piece, such as the one amendment that we had offered. I think that I think you should go back and take a good hard look at that small employer amendment and maybe take another look at that and possibly offer that in another when we come to the end. So I appreciate that. I'm just concerned about our schools and I've heard it from school districts, they're concerned about this. So just take a look at how that works, because this is all going to end up on our tax base through our counties, cities, school districts. All those taxes get paid by those of us that own property and rent property. So those are all property tax increases. And if you've seen, I bet you I got thousands of phone calls regarding property tax increases over this past summer. So it's a big issue. Whatever we can do to minimize that, I think we need to take a good hard look at that, and I appreciate it. And thank you, Mr. Chair.
Any response, Senator Mann?
Mr. Chair, as we go through this bill, we've heard that everyone's going to go out of business. We've heard schools are going to have to shut down, and after-school programs are going to shut down, and businesses will all close, and that we're not seeing that in other states. We're just not. And so I understand it's a fear that people have, but we're not seeing that happen.
Other member comments or questions? Senator Dames.
Well, thank you, Mr. Chair and Senator Mann. You make the comment that you're hearing about every school is going to close, every business is going out of business, et cetera, et cetera. But let's face the facts. The question was asked earlier about property taxes going up to pay for this on the schools. And you said you haven't seen it in other areas. But let's be realistic. It's either coming out of property taxes or it's coming out of the dollars that go to educate students. Unless there's something done to make the schools whole, it's going to come out of this money that goes, either it comes from property taxes or it's going to come from the dollars that go to teach students. And so I think we need to keep things like that in mind. And maybe when you're hearing about these people having to shut their doors and this and that and the next thing, not just brush it off as to this may not happen, because there will, I'm not saying every business will, of course they won't, but some will be affected by this. Some it'll be the last straw in their operation they have, and it's going to close their doors. So please do think a little about that and rethink some of the amendments that you chose not to take today that would make this bill better, that would make it something that would survive very well in Minnesota. So thank you for your work on this, but I hope that as you go on in the next couple of meetings, next couple of hearings, that you look for ways to make the bill better that can make both sides happier and make this work and make it more financially feasible for the people in Minnesota.
Response, Senator Mann.
Mr. Chair, I'm not brushing anything off Senator Dames, and I understand your concern. I'm just saying that this doomsday scenario that some people are painting, we're not seeing that pan out, which is very reassuring. And also, companies and businesses and schools, we're incurring costs now, right? People are leaving, and they're not coming back. And so we talked about the workforce in 10 years. This is a huge step in keeping people in the workforce 10 years from now. So I just wanted to point that out. And also, I will look at all of those amendments again, and I will talk to Senator Rasmussen again going forward.
Other member comments or questions? Senator Seeberger.
I wanted to comment how grateful I am for this bill. When I was a young attorney starting my family 20 years ago, I worked for a small law firm. I didn't make very much money. I made, in fact, very little money. And I think maybe Senator Frentz and other attorneys can attest that just because you're a lawyer doesn't mean you make a lot of money. I did not. And I worked for a small law firm. And when I had both my children, there was no such thing as paid leave. And I took, and in fact, we were small enough to not even fall under the FMLA. So I had to fight to get 12 weeks of unpaid leave. And in fact, they disputed me over 3 days of paid leave that I had accrued. So it was a fight. And I am grateful to see this come through in the state of Minnesota today. So hopefully other young attorneys don't have to struggle like I did when I started my family 20 years ago. It's 20 years later, I'm a small business owner. I left that law firm, started my own, and still continue to run my law firm today. I have 2 employees, and like Senator Duckworth, I would do anything for them to make sure that they are taken care of. But I'm grateful that I won't have to do that with this bill, and that they will be taken care of as employees, and I will be taken care of as a small business employer. So Senator Mann, thank you for carrying this, and I'm grateful to see this come through.
Senator Mann. Any further comments or questions from the committee? So Rasmussen, did you request a roll call?
Mr. Chair.
Roll call will be granted. Senator Seeberger moves the bill, and the question is on the motion of Senator Seeberger that Senate File 2 as amended be recommended to pass and be re-referred to the Committee on Judiciary and Public Safety. The clerk will take the roll.
Chair Klein.
Aye.
Senator Seeberger.
Yes.
Senator Dames.
No.
Senator Duckworth.
No.
Senator Frentz.
Yes.
Senator Wicklund.
Yes.
Senator Howe.
Nay.
Senator Latz.
Aye.
Senator Zhang. Senator Rasmussen.
No.
There being 6 yes votes and 4 votes, the motion carries and the bill is referred. This committee is adjourned.